I want to share with you how I successfully treated 2 years of chronic back pain with multiple bulging discs. G'day, I'm Michael from Fishy McFishface, this YouTube channel, and I want to share with you some of the benefits of snorkeling and how that made an enormous difference for my chronic back pain. Now, quick disclaimer, this is just me sharing my experience of treating back pain. It may not work for everyone, and this is not medical advice. I'm not a medical doctor. Okay, first of all, a bit of background on my back pain. I injured my back from a lot of intense activities like surfing, kayaking, and skateboarding, as well as a lot of desk work while doing my PhD. Over 2 years, I kept grinding through the pain, and every time my back would feel a bit better, I'd go out surfing, skateboarding, or kayaking again, and then my back would get worse. The severe pain would often be constant for days and even weeks at a time, and the normal pain never really went away. I struggled to sleep at night, and it ended up getting so bad I went into hospital once because of a breakdown from all the constant pain. Over the 2 years, I've seen a spinal specialist and had multiple scans, including MRIs, CT SPECT scans, X-rays, and the exact cause of pain is uncertain, but the MRI showed significant bulges in my T8 and 9 and 11 and 12 discs, as well as other bulges in L3, 4 and L4, 5 discs, and Schmall's nodes, which are like internal disc bulges, all throughout the thoracic spine, showing significant disc degeneration for my age. I'm only in my late 20s. So one of the doctors I talked to said, "Oh, you've got the back of like a 60-year-old instead of a 20-year-old. The specialist said that it's not the sort of thing that surgery can really help with, unless a last resort, especially given that I'm so young. I've been treated by doctors, physios, a chiropractor, osteopath, remedial massage, and even a psychologist for pain management strategies. Some of the painkiller medication I've tried included Panadol, Nurofen, Osteomol, Celebrex, Melobic 15, Valium, and Duloxetine. I also had an injection into the T11 nerve root, which wasn't overly pleasant, but it did help a little bit. Some of these painkiller treatments have helped a bit, particularly Valium for short term if I have a really bad back pain flare up, and the duloxetine is sort of a long-term thing to help me manage dealing with the pain sort of mentally. But that hasn't really reduced the pain that much. The physio exercises I've been given have been effective. Lots of core and glute exercises and back stabilization exercises. They've helped a bit, and I think that's probably been the most effective out of all the medical treatments I've had. Regular walking and swimming laps in the pool has also helped a bit, but by far the best pain relief and exercise I've found for my back pain has been snorkeling. That's right, chuck your mask on and your breather and get in the water. I told my physio about this and he wasn't overly surprised. He told me how the gentle kicking with flippers activates the back stabilizing muscles that I need to strengthen, which a lot of my physio exercises are targeting. And the effect of being in water can have a sensory deprivation effect that stops the brain from directing so much focus on the pain source. I've also noticed that in any activity I do which involves controlled breathing, such as swimming and especially snorkeling, my pain is reduced. When chatting to the psychologist, they were explaining to me the sympathetic and parasympathetic nervous systems. Deep breathing techniques, especially with a longer exhale, promotes activation of the parasympathetic system, which helps the body relax. On the other hand, shortened breathing with more emphasis on inhaling can activate the sympathetic system, which is related to stress. The stress, of course, amplifies chronic pain. So it is good to practice activating the parasympathetic nervous system to deal with chronic pain. Now, I've actually got asthma and I've struggled with a lot of asthma over these last 2 years as well. So you can imagine how that factors in for, that shortened breathing and not as much exhale for my chronic back pain as well. That hasn't helped. So the swimming, things in the water, this is all good for asthma as well. When snorkeling, the breathing is very deep and relaxed, and you've got to breathe deeply because you've got to push air through this snorkel and pull it in. So deep breathing, not shortened breathing. And I'll often, when I'm snorkeling, I'll dive down, not too deep, but I'll dive down and hold my breath to film marine wildlife, which is a lot of the videos on this YouTube channel. Now, to get the best shots of marine wildlife, you need to be slow, very slow moving and calm. Otherwise, the fish will just spook and they'll swim away. And you also need to dive down to their level to get the best shot. So it's nice getting footage when you're down at their level. Often after taking in a deep breath, I'll exhale a little bit of air as I'm going down in the water, very slowly, to reduce my buoyancy and get a bit deeper to film a fish for a while. And I'll remain there until I need to breathe, up to about a minute. This deep breathing and controlled exhaling and focus on filming fish rather than on my pain all seems to really help. The other thing is the visual nature of fish in the water is very graceful and smooth and calming. All these factors seem to tick the boxes of chronic pain management strategies that I've heard from the experts, like deep breathing, mind distraction techniques, calming or meditation, gently exercising back stabilization muscles, and sensory deprivation through submersion in water. The other thing which is surprisingly helpful was creating slow motion videos from my footage. So I do my snorkeling, get home, my back's feeling good after the snorkeling, so I'm fine to sit down and process some footage without any pain. And I'll upload that footage often to this YouTube channel called Fishing McFishface. The graceful swimming of the fish, especially in slow motion, and gentle swaying of seaweed and coral, and the colours of green and blue in that pastel or lights, pale sort of colours, with peaceful music, all these factors are very relaxing. And if you have to actually look up, there's a bit of research behind those sorts of colours in helping you get to sleep and relax, and slow things helping you relax too. A number of times I've had a flare up of back pain, and instead of choosing to take a Valium tablet, which is the stronger painkiller I've got, which can become addictive from what I've heard from the doctors, so I try not to take it very much. Instead of having to take a Valium tablet, I've just lied down in a comfortable position and watched one of these slow motion videos. Amazingly, after about 5 to 10 minutes, I'm more relaxed and I notice my pain starts to go down. Sometimes, of course, medication is necessary. So if you've got medication and, I wouldn't say throw it all out and watch my videos, use the things the doctors have prescribed. But if I can manage my pain without medication, that is a much better outcome. And doctors have told me that too. If my back pain is preventing me from getting to sleep, often I'll have melatonin tablets. That's one of the things my doctor prescribed for me. And that helps. It takes about 2 hours to kick in. But you can't have it every night because then your body gets used to it. But I've started to not do that as much and now just watch one of these videos that I've created. And they're very relaxing and peaceful, and maybe they're boring because they make me go to sleep after about 20 minutes. So that slow motion underwater footage makes me sleepy, and This get to sleep. Within 20 or 30 minutes, I'll feel so sleepy, I'll turn it off, and then I'll go to bed. So anyway, I thought I'd share this with you in the hope that snorkeling, and maybe even the videos that I produce on Fishing McFishface, can be helpful for treating your back pain. I still have some back pain, but with the regular snorkeling, and I try to go once a week, and physio exercises, my back pain is getting much better now. I'm sitting down in a hard chair right now, talking to you on YouTube, and I'm almost back pain free. It's not really bothering me. I went snorkeling just yesterday. So for those of you who are interested in snorkeling, to treat your back pain, or just snorkeling in general, because it's a great thing to get involved with, I'm going to be posting videos on this YouTube channel, Fishing McFishface, about cool places to go snorkeling, tips on how to get the most out of your snorkeling, tips on filming underwater, fish species identification in the shorts, and heaps more content. So make sure you like and subscribe and share your thoughts in the comments on treating back pain and how you've found success. I'd like to hear that too. Anyway, I'll see you in the water.